Hello friends, welcome in this channel totalphysiology.com. I am Dr. B.K. Prasad. I am going to talk about Cushing Syndrome. Cushing Syndrome was first described by Harvey Cushing. Therefore, it is Cushing Syndrome. Definition of Cushing Syndrome. Cushing Syndrome is group of symptoms that is produced due to prolonged excess amount of corticosteroid, glucocorticoid in blood. Prolonged and excess amount of glucocorticoid in blood. Then question arises, what is normal? What is normal? It is about 10 to normal 10 to 25 microgram per deciliter. And daily secretion is 5 to 30 milligram per day. Half-life is 60 to 100 minutes. 60 to 100 minutes. When in circulation, this amount is exceeded, is in excess, then it is known as this higher level, that is more than normal. Causes of Cushing syndrome. Causes of Cushing syndrome. We may divide it into extrinsic cause. Extrinsic or external cause. This is prolonged use of corticosteroid, prednisolone and dexamethasone. This is prolonged use of corticosteroid. It is also known as iatrogenic. Iatrogenic means produced by doctor, prescription, external. Then second is intrinsic or intrinsic causes or internal causes. Internal causes. In internal causes, number one, pituitary adenoma. Pituitary adenoma. Then pituitary adenoma. This will cause Cushing disease. This will cause Cushing disease. It is slightly different from Cushing syndrome. The difference is in Cushing disease, there is pigmentation due to the fact that ACTH have some function like beta MSH, melanocyte stimulating hormone. Therefore, it causes pigmentation. Then, second is ACTH secretion from other sites. Secretion from other sites except pituitary gland. Then third is adrenal adenoma. Adrenal adenoma, adrenal hyperplasia, and adrenal carcinoma. These are causes of this Cushing syndrome. Now coming to clinical features. Clinical features. clinical features. Due to disturbance in protein metabolism. Protein metabolism. Effect on protein metabolism. It is catabolic. Negative nitrogen balance. It causes negative nitrogen balance. Negative nitrogen balance, therefore retard the growth. Second is it causes proteolytic. It has proteolytic action on muscles and other parts. When it is on muscles, mainly on muscles, it causes weakness of muscle. Weakness of muscle. It causes loss of muscle protein. It causes weakness of muscle. This is known as steroid myopathy. Myopathy. It is steroid myopathy. Then, due to its proteolytic action, skin becomes thick, skin becomes thin, there is hair loss, fibroblastic activity is reduced, fibroblastic activities are reduced, leading to poor wound healing. Poor wound healing. Then it has action on bone. Action on bone. Osteolytic action. Bone becomes weak and this may cause fracture. It has proteolytic activity, action especially on bone, weakness of muscles will occur causing steroid myopathy. Then skin becomes thin, hair will lose, fibroblast action are reduced and osteolytic action. Now effect on due to clinical features due to effect on carbohydrate metabolism. It causes number one, increased amount of glucose. It increases blood glucose level by formation of glucose in the liver. Gluconeogenesis. Glucose are increased formation of glucose in liver by amino acid. From where amino acids come? Amino acids come due to its proteolytic activity on the muscle. Amino acids are formed in excess amount and it will go to the liver and liver will form glucose. Second is reduced insulin sensitivity. Decreased insulin sensitivity in peripheral tissue causing decreased utilization of glucose in the periphery. It helps in increase of glucose level. These will cause diabetes mellitus. These two factors, increased formation of glucose in liver and reduced peripheral utilization of glucose, will cause diabetes mellitus. It is adrenal diabetes. It is also called adrenal diabetes mellitus. Third is ketosis. Ketosis may occur. Then disturbance in lipid metabolism, hyperlipidemia, lipid metabolism. Now, clinical features due to effect on lipid metabolism. Due to effect on lipid metabolism. Effect on lipid metabolism. It causes removal of fat removal from peripheral tissue, extremities, legs become thin, arms become thin, then fat removal from periphery and periphery. And second is redistribution of fat, redistribution of fat. This redistribution of fat in centripetal or truncal distribution. Truncal distribution means fats are deposited in centripetal from, that is in midline, that is truncal distribution. This causes, what is the effect? Moon-shaped, moon-like face. Second, buffalo hump. Buffalo hump is excess deposition of fat in the upper part of the back here. This is buffalo hump. Third is pendular abdomen. Pendular abdomen. And when the size of abdomen and abdominal wall is stretched, there are stretch marks. Stretch marks here. This is function due to clinical feature due to effect on lipid. In Cushing syndrome, there is immunity is depressed. Immunity is depressed. It causes increased chance of infection. Then due to action or due to as mineralocorticoids. Glucocorticoids have some feature, some action, mild action like mineralocorticoids. That means it will conserve sodium, reabsorption of sodium and water, leading to increased blood volume and leading to hypertension. Then it is also acts as beta melanocyte hormone causing hyperpigmentation of skin. Hyperpigmentation of skin. Miscellaneous effects. It causes psychosis, different types of psychosis, depression, dementia, etc. Then increase in neutrophils, increase in RBC, and increase in platelets. These are the features of Cushing syndrome. Now coming to diagnosis. Diagnosis by is by number 1, 24-hour urine analysis for free cortisol. Number 2, late night salivary cortisol estimation. Salivary cortisol estimation. Then third, plasma ACTH estimation. ACTH, that is adrenocorticotropic hormone estimation. Number 4, MRI and CT scan of pituitary gland and adrenal cortex. Pituitary gland and adrenal glands. Most important, 24-hour urine analysis and late night. And if these are present, then we will go for MRI and CT scanning. Now differential diagnosis. How we can differentiate it from, that is, there may be differential diagnosis, may be simple obesity. Number 2, alcoholism. Number 3, depression. Then polycystic ovarian disease. These are included in differential diagnosis. Differential diagnosis. Then treatment. Although treatment is not part of our physiology, but just to know, first is healthy lifestyle. That includes healthy diet, normal diet, proper exercise, healthy normal diet, proper exercise, proper exercise and sufficient deep sleep, deep sleep. Then medical treatment. Some drugs are there, for example, ketoconazole. Then surgical treatment, and when surgery and drugs fail, then radiotherapy. Radiotherapy. What are the long-term effects of Cushing syndrome? Treatment is must, and otherwise what? Long-term effects of Cushing syndrome. Number one, you know that it causes hypertension leading to stroke, may cause stroke or myocardial infarction. Second is diabetes mellitus. Diabetes mellitus. Number three, as immunity is reduced, infections. Infections. Infections may be due to reduced immunity and due to diabetes mellitus infection. Main hypertension, diabetes mellitus, including their complications, infection and reduced immunity. These are the long-term effect of Cushing syndrome. So, in this chapter, in this topic, we have learned about what is Cushing syndrome, definition of Cushing syndrome, and what is Cushing disease. Then causes of Cushing syndrome. What are the causes? We learned. Then clinical features, diagnosis, line of treatment, differential diagnosis, and long-term effect of Cushing syndrome. And what is the normal level, plasma level, and what is daily secretion. All these things are covered. I think it may help you. So, if it is helpful, please like, subscribe, and share this video. Thank you very much for watching. Thank you.